Jamaican authorities are concerned about reports that some countries are not accepting proof of COVID-19 vaccines being administered by developing countries. Chief Medical Officer Dr. Jacquiline Bisasor McKenzie addressed the matter and others while speaking at the 59th PAHO Directing Council meeting. More from Simone Absalom Gayle.
Dr. Jacquiline Bisasor McKenzie shared some of the challenges being faced by the Jamaican government in its management of the COVID-19 pandemic.
This threatened to derail our response and undermine the trust in our health infrastructure, as there were long turnaround times for laboratory tests, as well as dissatisfaction among healthcare workers about supplies of personal protective equipment. In the last few months, it has been the shortage of vaccines, as promises for supplies are delayed as larger countries continue to pull and engulf resources. Even more recently, the break in our supply chain for liquid oxygen created periods of uncertainty in our hospitals.
She says the challenges play a part in her ministry's decision to support the development of regional capacity for the production of medicines.
It is with these experiences fresh in our minds that we support multisectoral action and an increase in regional capacity for the development and production of medicines and other health technologies to improve access and enable consistent and reliable response to the region's health priorities.
Meanwhile, Dr. Bisasor McKenzie is calling on the Pan American Health Organization and the World Health Organization to ensure that countries recognize accredited vaccines.
Jamaica would ask that the WHO and PAHO intervene to ensure that essential medicines and health technologies that have gone through the rigors of approval are recognized and accepted globally. This we ask as vaccines approved by the WHO, taken by our citizens, are not being accepted in some countries.
The CMO says Jamaica recognizes aid given by PAHO and the WHO in procuring vaccines for the Caribbean. She is looking forward to those being developed in the region.
We also recognize the work of Cuba in the development of vaccines that will no doubt benefit the entire region. And we would also like to recognize Trinidad and Tobago and Costa Rica that have supplied us with liquid oxygen.